We grew from 17 clinics to 20 clinics to 40 clinics to 52 clinics, and we outgrew our management style. Staying connected became difficult, and we started to lose some of our core values within this organization. Kind of what made us special, what made us hold together in the first place. And we were having issues all over the place. Our hours became enormous. People were burning out. They were just tired. Our doctors were tired. They were tired, and I personally was tired.
We had to unfortunately make layoffs and downsize due to the economy. And for quite a while, the morale was very low, and people didn't know whether they should stay with Allied Health or they should look elsewhere for a different job, if their job was secure or not.
And we got kind of a crisis point. I mean, we couldn't just because we were friends run this thing anymore. We had to have tools and better tools. And when we went out there and searched for tools, one of the tools that was available was the VIA. So the VIA is designed to find out the character strengths that make people people, and they were put together through cross-cultural evaluations of people through time and different cultures and religions, and what keeps coming up repeatedly. And they boil it down to 24 character strengths, and they'll rank them from 1, what you most commonly use, to 24, what you might least commonly use.
The character strengths that you see in the VIA are really all necessary to build an organization that's sustainable.
Making people aware of their strengths is going to enhance their performance.
My number 1 is spirituality.
Number 1 is honesty.
Love of learning, forgiveness, humility.
Zest is my number 1. Love of learning is number 2.
My top strength was forgiveness and mercy.
Love of learning. I thought everybody had that.
That's why I behave that way sometimes. It's not a negative, but it's actually a strength.
Humor ranks pretty low on my VIA assessment.
So we all took the VIA survey and came back with our results, and we discussed these each week in our management meetings.
We want to learn how each person operates, how they interact with people, and what's important to them. So the character strengths really show that. It's fun to hear what everybody's are because everybody's different.
I'm just a terror to manage for my organizers, so my 2 closest people to me in the corporation, their strengths are they're really good organizers. I mean, tremendous organizers. I would ask the people that had much more organizational strengths, can you close the meeting so that next meeting has some semblance to where we ended this meeting? Can you tell us where our start point will be for the next time we get together?
I had to realize who he was and, what's going to get him going, what's going to drag him down, and how I'm going to be effective in his day-to-day routine. The VIA has certainly helped me manage my manager in a more effective way.
All of us have strengths, and trying to find how can I better utilize my strength with somebody else's strength, and then finding a balance.
Typically, utilizing those strengths help me enjoy the things that I do on a daily basis and feel less guilty, if you will, about not doing the things that I don't enjoy and I'm weak at.
Getting to know everybody that has been in our groups when we have discussed the VIA survey, every aspect of it adds that helping to develop that confidence of yourself.
I've been able to take this home and work on not only, myself, but also my family life. It's brought me closer to my husband and even to my parents and my siblings and even my kids.
So you commit to the VIA, and now you need to have a champion. And that champion, best of all, is as high up on the hierarchy of authority as possible. CEO, perfect. Then that CEO needs to look around him and say, what's the next level of champions? Who is going to be adaptable? And don't make the mistake of saying, this is my least adaptable person. They need it the most. It's not who needs it the most. I think you start with who needs it the least. I kind of make it simpler all the time. I mean, we don't make it real complicated, and I think that I don't want them to remember they're 1, 2, 24. I just want them to kind of first appreciate each other. It's kind of funny, when people are engaged with a VIA, they truly want to engage other people with it. It's something they want to share.
As an organization, I think that we have improved.
I think just getting to know each person and how they function and how they relate, then you have a good base to establish how do I approach this person and communicate to them that this is important and this is going to be beneficial for them.
And on the average, we probably have 85% of our staff is fully engaged. They want to be at work, they care about what they're doing, and they're not just going through the motions. You know, they know that their employer cares and they care as an employee.
Personally suffered from depression in my 20s and anxiety disorder, and I've had kind of a long journey towards health in general. When Dr. Bouch introduced me to VIA, in terms of thriving, I would have rated my, on a scale from 0 to 10, I would have rated myself a 3, and now I would say I'm an 8.
It's been a kind of a transformation for me in a more of internal into external life, into a, sort of growing out of myself and really allowing those strengths to really come out into play and not feel like I have to suppress that. That's who I am and should be proud of that, So yeah, it's definitely been a huge eye-opener for me.
It's bringing soul to the workplace.
I think it's great that, I work for a company that really takes this VIA assessment and puts it as one of their cornerstones of the company, because it makes me as an employee feel like this company cares about me. It cares not only for my professional success, but also for my personal success as well. And it's easy to come here with a positive attitude because you know what you're looking forward to.
Since we incorporated the VIA strengths, we've had our best numbers since we've changed the way we looked at problem solving. Changed the way with the VIA has made us just look at our corporation differently. Great dividends on the financial side. And so this isn't about a win-win that people feel better. The end win-win-win is that your organization is more financially viable and more flexible and has more survivability, because that will come. Maybe the end of the story is we went from the toughest year Allied Health has ever had to rebounding, and within 2 years we had the best year that Allied ever had.